Hello, my name is John Demore. In this session, we'll review clinical data enrichment by the Diameter Health software. When people want to run analytical queries on clinical data, often they ask relatively simplistic and straightforward clinical questions, like find me all patients on a beta blocker. To execute on this clinical query in the absence of clinical data enrichment and normalization, it becomes quite complex. First, you would have to map each of the drugs that are a beta blocker. Then, for each one of those drugs, you would have to find its concepts in multiple terminologies, and also be able to decompose free text that actually records this drug administration. Beyond that, there are also brands and combination ingredients that can contain individual beta blockers, and you would need to scan for all of those. We've taken a relatively simple clinical query and turned it into a query that will require dozens, if not hundreds, of joins among multiple different terminologies, codes, and free text. But what if there were a simpler way? Clinical data normalization and enrichment allows each one of the medications to be tagged with relevant clinical data that makes this a very simple clinical query. Let's go a little bit further in the example. Say that you have 3 patients, each on an individual beta blocker shown on the left hand of the slide. After that information flows through Diameter Health's normalization process, you will have a concept for each one of those drugs in a normalized code system, such as RxNorm. Once this information is in RxNorm, we can also begin to enrich it and actually tag metadata to say that this is a beta blocker drug. And we use a code and code system such as NDFRT to represent that information. This information is stored in the JSON data model of Diameter Health, and this specific example is stored in our CCS property, or clinical classification system. Next, let's speak about the differences between data normalization and data enrichment. Normalizations focus on improving data that would be expected to be recorded at a source. For example, with a medication, we would expect to have some sort of code associated with what that medication is. While normalizations do not replace the original data in Diameter Health's JSON data model, they may be used to improve outbound interoperability. In contrast, enrichments focus on providing data that can be helpful in analytics and in data usability, but would not be expected to be recorded from a source. In the example provided on the prior slide, we would not expect a doctor prescribing metoprolol to record in their EHR that it's a beta blocker, even though they very well may know that. While enrichments may be included in outbound documents from Diameter Health software, they may not be expected elements in data interoperability standards, so you may not always see them there. Some examples of clinical data enrichments that we provide by section include socio-demographic lookup information from the demographics, such as the income for a particular zip code, drug class and ingredient decomposition, medication SIG natural language processing, as well as controlled substance information provided on medications, code equivalence mapping, problem duration, groupings for revenue and clinical classification among problems and diagnoses, for procedures and plan of care, code equivalence mappings and groupings for revenue and clinical classification, and for results, national reference ranges, and also classification in particular labs. As a follow-up to this session on clinical data enrichment, we encourage you to look at the Diameter Health data model recorded on www.clinicaldatamap.com to learn more about what we enrich in clinical information. We also encourage you to learn more about how Diameter Health reorganizes and deduplicates clinical data in future sessions. And we also encourage you to understand how CCDA outbound documents can be configured so that they may include or not include enrichments to the data. Thank you.